Okay, so once again, welcome everyone to today's Health and Wellness Ask the Expert series. My name is Chantel Ramsey. I'm a policy analyst here with CSG. And today my colleague Mari and we have lined up an excellent panel for you all. So we all know that this holiday season can be extremely hard, especially for our first responders, particularly for several reasons. The increased demands on calls for service, there's often a surge in emergencies, which often can increase the stress for our first responders. So during this holiday season, it may also trigger past traumatic incidents, which intensifies the emotions and which we all know can lead to burnout. So we want to acknowledge these challenges and provide additional support and resources and empathy to our first responders during this crucial time. So today we'll be gaining knowledge and insight about health and wellness from our expert panel. They're here to answer your questions, share resources, and lessons learned. But first, Mari, my colleague, she'll lead us in a brief breathing exercise to help us center our emotions. Mari?
Thanks, Chantel. Hi, everyone. As Chantel said, my name is Mari, and I'm going to walk us through a quick grounding exercise. It's called square breathing. It's most easily accomplished by pairing it with another breathing exercise called deep breathing. So what we're going to do is we're going to picture a box in our mind where on one side, we breathe in through our nose for 4 seconds. I'll count for us. After we breathe in deeply through our nose, we're going to hold for 4 seconds before breathing out through our mouth for another 4 seconds, holding for 4 seconds before starting the process again. So how most people do this, I'm going to step back without standing on a cat. You're going to take one hand and place it on your chest and the other on your diaphragm. What this does is it allows you to track how you're breathing. What you want is you want your chest to stay still while your stomach or your diaphragm does most of the work. What you'll do is you'll take a deep breath in, making sure that your diaphragm is the one pulling out. So your stomach is actually going to feel like it's inflating. You'll hold before breathing out your mouth, and your stomach is going to deflate using your diaphragm. This ensures you get a full deep breath into your lungs. I'm going to start us off now with 1 deep breath in through your nose, 2, 3, 4, hold, 2, 3, 4, breathe out your mouth, 2, 3, 4, hold, 2, 3, 4, in through your nose, 2, 3, 4, hold, 2, 3, 4, out through your mouth, 2, 3, 4, hold, 2, 3, 4, one more time, 2, 3, 4, hold, 2, 3, 4, out through your mouth, 2, 3, 4, hold, 2, 3, 4. Now we only did 3 box breathings. There's no minimum, no maximum to use this breathing technique, but I do recommend using it anytime you just need to check in with yourself, ground yourself, prepare yourself for any task that is to come, whether that's grounding yourself and energizing yourself at the beginning of the day when you wake up, whether it's during lunch or in the middle of a meeting where you just need to check in, stop, pause, and prep yourself before you take action, or as you're getting ready for bed where you need to wind down, relax, and fall into a deep sleep. I recommend doing it at least 3 times a day, however. All right, so I'm going to kick it back to Chantel to get us started with this incredible panel of experts.
Thank you so much, Mari. We are so excited today. We have our panel of 4 experts here, and I am going to ask each of our panelists to go around and introduce themselves, the work that they do, how do they define responder, how do they achieve wellness in their work. So first, I'm going to hand it over to Dr. Anna Curry.
Thank you so much, Chantel. And good afternoon, good morning to wherever you are in the world. I first want to address the elephant in the room, which is my voice. I apologize profusely for sounding a little gravelly. I feel fine, but I have been struggling with laryngitis for the last 2 weeks. The last virus that went around really did a number on me and have been struggling to get my voice back. So I apologize in advance, but wanting to be here with you today. Wellness is something that I live and breathe as a part of my personal and professional life. I serve as the director for first responder health and wellness at the FirstNet program at AT&T, where I lead a national effort to create advocacy and solutions across all of public safety. From the moment that call is made to dispatch, when your traditional first responders arrive on scene with fire, EMS, law enforcement, if it's a large scale disaster where we have emergency managers that are engaged in the disaster response, corrections, and other that support the public safety world, all the way through until those victims get to the healthcare arena. That's kind of how I see public safety and who we need to support with wellness. Because when you do a deep dive into the problems facing that population, we see consistently in the helper professions depression, anxiety, post traumatic stress disorder, leading upstream to suicide, and also downstream to some of the physiological effects with cancer risk factors, hypertension, cardiovascular disease, um, injuries, metabolic disorders, and many other issues that are all related in this mind, body, and spiritual connection that we call wellness. So for me, it's very important that wellness weaves itself through everything. Okay, all parts of an organization, all parts of the individual, all parts of the communities that we serve. And I look for ways how we integrate and collaborate across public safety to support those issues. We look and measure integration of wellness programs related to how many policies are we writing at the national level? How have we increased awareness through impressions and engagement? How are we reducing stigma by opening up the conversation to discuss very openly this problem facing public safety? And then how many programs that are evidence based are being implemented across public safety to address their health and wellness? So when you look at the impacts, when you look at wellness, we don't want just to look at the small micro level where we're talking about individual interventions, but all the way out and keep growing the different levels that we can address the health promotion of the population, all the way out to the national and federal level. So we're looking at big. How does that affect our communities and our organizations? How does that affect our families, our units, our teams, and our small groups? And then how do we intervene at the individual level? So there's all sorts of scopes when we talk about building wellness programs, the things that we can do and the strategies that we can implement. And that's kind of my specialty. It's really the strategy of implementation of wellness programs for non-healthcare organizations. Looking forward to the conversation today. I welcome you to ask questions. This is going to be as engaging as you make it as you interact with the four of us on this panel. And with that, I'm going to pass it off to the lieutenant to introduce herself. Thank you.
Good afternoon, everybody, and thank you for having me, and thanks for jumping on this today. So I'm currently, my name is Lieutenant Angela Favaletti. I'm the lieutenant here with the Bexar County Sheriff's Office in San Antonio, Texas. And my present position right now is I have our mental health unit, which is one of our larger divisions here at the Sheriff's Office, as well as our peer support and our crisis negotiation teams. So I do a little bit of everything here at the Sheriff's Office. In particular, talking about wellness, this is something that was is relatively new to our agency. And I say that in the last few years, we've really started to pick up our wellness programs. When it comes down to things, we measure things here at the Sheriff's Office, is the first thing we started to notice was retention. So the amount of officers, deputies that we're keeping in these positions, to include civilians, we noticed that a lot of our retention issues go back to wellness, goes back to mental health, goes back to their physical health. and so forth. So we really started to ramp up a lot of, excuse me, our wellness, kind of our wellness initiatives around in here at the sheriff's office. We have a peer support program. That's kind of like one little facet of what we do here. Normally what we do is we try to reach out to both dispatchers and deputies, anybody that was involved in critical incidents, to touch base with them on how they're feeling after those incidents, and programs that we can, you know, put them in if we need to, as well as just doing a roundabout with 30 days later, doing checkups, just doing kind of checkups with them to see where they're at in those programs. A broader range of what we kind of started to do was start institute some preventative care, which was, it went down as far as getting gym memberships. We were able to coordinate with a lot of gyms around town, so a lot of the county employees have free gym memberships, as well as mental health resources. We're able to push out to a lot of our, you know, our staff and our employees, so they're able to reach out for, as far as mental health care was concerned. We do free health care, the healthcare screenings here with the sheriff's office, as well as try to promote a lot of those health fairs, which, you know, it goes back down to, like we were saying, our physical health, whether it was a cardiac health, you know, diabetes was a big one for a little while, and making sure that, you know, we're trying to tackle all three facets of just wellness in general. And again, measuring the impact, we kind of go back to looking at, you know, are we keeping, how's our, you know, our staffing? Are we keeping staff? Are, you know, what our sick calls look like? What do the peer support reach out look like? Are we going up or are we going down? Some of those are little ways that we kind of keep track of how we're doing with employees in general. And we're really trying to kind of not reinvent the wheel, but make it better. Try to make new programs where we can catch things before that they happen. And that's where a lot of these outside resources, like the doctor was talking about, come in extremely handy. So again, I appreciate y'all being here and having me today, and look forward to the conversation.
Thank you, Lieutenant. Good afternoon, everyone. Thank you for being here. My name is Jessica Samples, and I'm very grateful to be on this panel, learning and sharing my experience. Being an Ask the Expert series, I must tell you, I am not an expert on giving introductions, so stay with me and we'll get through this together. I'm a peer by trade, and my background involves crisis and emergency services, suicide prevention, and CIT, crisis intervention training for both law enforcement and security teams. I worked with Lieutenant Frevaletti on the SMART team for Bexar County in San Antonio, Texas. With SMART, I served on a multidisciplinary team, both on response and follow-up. In my current role, I serve as a training specialist for 988, educating peers and crisis counselors to be the first point of contact on the suicide and crisis lifeline. I define wellness in my work from a holistic, multifaceted approach. As a peer in crisis and emergency services, I've learned through experience that these programs are new and the peer role is not fully fleshed out starting out. So I decided to see this as an opportunity for creative solutions. So my wellness approach personally has involved creating a path where I feel fully seen and supported in my roles. That requires accountability on behalf of myself, my team, and leadership team. We can dive into that further if you'd like later during the Q&A. One of the ways I help responders achieve wellness is through education and creating a safe space to be a different lens for them to view their wellness through. What I mean by that is, I've noticed through my work in CIT that I have the ability as a peer to soften the room using vulnerability. Naturally and respectively, a lot of times people want to show support by being very formal or politically correct to me as a peer, which is very much appreciated. However, I work to create a culture of openness and curiosity. I strive to allow people to soften and be brave to ask those hard questions we often avoid. I encourage you all to do the same today. That's how we learn and grow together. Some of the ways I measure impact is by staying solution-focused, having two-way communication, and providing space for anonymous surveys. I want to create a culture of wellness with creative solutions to support individuality and intersectionality. It's important for me to remain a student, and I would be honored if you would take the time to provide feedback on the survey at the end of the webinar. Our next panelist needs no introduction, but I will pass the floor to him to do the honors. Thank you.
Thank you, Jessica. And first and foremost, I just want to say thank you to CSG for facilitating this wonderful series. I hope to learn as much about this as the participants themselves, given the incredible panelists that we have joining me today. My name is Austin Sanders, and I am the Director of Innovation for the City of Huntington, West Virginia. Prior to being named Director of Innovation, I worked in police and fire for approximately 3 years, leading our innovative program that I'll get to in a little bit, and still have really the blessing of working with that program in my current role as the Director of Innovation. But I don't want this to serve as an introduction to me, but more so an introduction to where I'm from, and that's the small town of Huntington, West Virginia. You know, West Virginia is the only state that is entirely in the Appalachian region itself, and we were hit incredibly hard by the opioid crisis. In here in West Virginia and in Appalachia especially, we pride ourselves on having a incredible work ethic. We pride ourselves in knowing that we typically have to work twice as hard as the average Joe in order to get a leg up in this world because of our economically disadvantagement. And when the opioid crisis happened, it hit Huntington, West Virginia, like nothing you've ever seen before. Um, we had a drug overdose rate 10 times the national average at our peak. We're a town of 48,000 people. Our police officers and firefighters, and I love asking our police officers and firefighters when we first hire them, it's why did you want to get into this profession, right? And typically they'll say, because I want to help people. Our police officers and firefighters want to come in and save the day. But with the opioid crisis, they were seeing the same people over and over again in this repetitive cycle. They felt like their job, it's not just a job, it's a livelihood. It's who they are as a person. That was challenged. They were no longer saving the day like they thought they were. And on top of that, you administer Narcan and a person wakes up with dope sickness. It's like the flu times 10. So not only did you save a person's life, but they're waking up angry at you, wanting to fight you. And then you have the feeling like, oh, they're so ungrateful. I just saved their life and now they're mad at me. We knew that as we became a city of solutions, we had to put a big emphasis on police officers and firefighters and their wellness, particularly because not only did the volume change, we were seeing a lot of overdose calls, but like I said, we're a small town in Appalachia. The people that we were responding to were not only overdosing, but they're people that we grew up with. They're people you play little league softball with. They're people that you go to high school with. And that has an enormous impact on the health and well-being of police officers and firefighters. And so we entered what was called the Bloomberg Philanthropies U.S. Mayor's Challenge with a very simple goal of we wanted to create a first of its kind, holistic, data-driven wellness program to prioritize the physical and mental well-being of our police officers and firefighters in the city of Huntington, West Virginia. Not only create that, but create a program that can be replicated in other cities across the country and more particularly can be replicated in other industries. Of course, during the competition, we were one of 9 cities to win $1 million. Other cities were dealing with various things, but COVID hit, right? And that was a really turning point for us because then we soon realized that it's not just overdoses that are occupational stressful for police officers and firefighters. So what that allowed us to do is create a holistic program where we embed wellness coaches within our police officers, police and fire departments. We have policies, we have a wellness lounge, we have activities. All of this, though, is driven by data. We as a city are taking a strong stance, and we'll get into this later, but it's a very simple philosophy of in God we trust, but everyone else bring data. And so what I hope that you leave here from is an understanding of where I come from in West Virginia and what we have been dealing with. But more importantly, I hope here that you leave with the resources that you need, but in particular, that you understand the value of data with respect to creating a program, because we have the most sacred obligation, just as our police officers and firefighters and EMTs wear the uniforms of our community, we have a very sacred obligation to serve and protect those that serve our communities. And so, with that, Dr. Curry is dropping some videos that we did with FirstNet recently, a little over a year ago. If you want to learn more about the program, highly recommend you check those videos out. There's one video in particular with a firefighter, Sam Roy, who is just has an incredible story. So I want to thank you all for the privilege of being able to share Huntington, West Virginia's story, and looking forward to our discussion today.
All so much for those wonderful, wonderful introductions. I'm going to start off first and warm up the panel with some questions, and then folks please feel free to drop your questions also into the chat. So my first question, what are some essential parts of wellness for staff that you guys can discuss?
So I know for us at the sheriff's office, we had to look at making sure that we had, all the different facets of what you would think would be wellness covered. It's a little different, I think, when you're talking about first responders. You can't necessarily just go to anyone, because this is going to be kind of a special population per se. So when we started examining, our wellness programs here, we had to decide, what exactly we wanted to offer, how we wanted to offer it, and how we were going to push that message out. And it does go back to when they were cadets. We found out that if we get to them earlier, right, and are able to explain what things they may encounter, and if so, these are your options for help, to include, like I said, it goes back to, we have peer support program and onboard psychologists that you could speak to, outside resources for mental health and things to be aware of as they progress through their career. We had kind of started on the other end when we first started the program, and we were catching people that were already having issues. And, by then, it takes a lot more, to provide them help. If we start earlier on and kind of, explain to the newer folks that are coming in, like, these are things to expect, these are things to look out for. And so, and what things can we offer that's going to be more preventative in nature? So again, so we went back to looking at just everybody's physical health, trying to bring in experts on different fields, whether it was diet and exercise, whether it was mental health wellness, bringing that into our agency in-service classes, which are required. You have to take X amount of hours every year. We started pushing that into our in-service, and along with firearms and these things that you typically go to an in-service, we actually started to add some of those classes in, include financial wellness was one of the things we also added into our in-service, which seemed to help a lot. And as they move through their careers, was again trying to get back to them again and readdressing, I guess you could say temperature checks on how everybody was doing. After critical incidents, we started having debriefs after that with mental health professionals, along with peers. Jessica mentioned, the peers are a big portion of our program. So we have other deputies and supervisors that's strictly volunteer. They take, training 4 or 5 times a year, and we basically reach out to anybody that's been involved in a critical incident, offering support. It could be as much as just an ear, following up on those folks to make sure that they didn't need anything else. Sometimes it's a ride, or it might be something, as far as talking to their immediate command about taking days off, for just time to kind of recover from whatever incident that they were involved in. So I think it's really important that, I think especially coming from a law enforcement end, we look a lot at the physical things that we do. Are you able to, shoot your weapon properly? Or do you good with your tactics? Are you able to, keep up with your report writing, or how do you drive a vehicle? Are you safe? And we push all these classes, but we really missed out on a lot of the wellness portion of mental health or just physical mental health. And so a lot of this stuff is brand new. I mean, to our agency anyway. We've probably really been trying to make a big push the last few years. And every year we just add to that, expand it or change it, because it's the more we learn about, incidents, for instance, suicide. Our agency, we've suffered, the loss of deputies with suicide. That's one of the leading causes of the death right now for police officers. So that's something we're really trying to get in front of. And it's learning from some of these situations that we've had, like if, maybe we should have done X or we should have done Z, and then revamping the program as we move forward to try to catch more of those things. So I think for us, essentially, it's really making sure that your wellness program incorporates kind of, a little bit of everything. Is it just going to be physical, or maybe it's not just mental health? It could be, again, financial health. It could be all of these things wrapped up into one program, and really look at your particular staff, what may be the issues that you're gonna run into later on, whether it's alcoholism, talk about drug abuse. It could be, mental health issues. PTSD obviously is a big one for us as well. We started even having resources. We brought in resources for marriage counseling, all those things, because again, within this profession, divorce is rated pretty high in our profession. So we've tried to, add things as we move forward, as problems presented themselves, to kind of get in front of them, but also have the kind of resources just ready in hand. And Jessica, you want to speak on that a little bit?
Sure. Thank you, Lieutenant. For wellness for staff, for me personally, a lot of it was really defining what my why was from the beginning, so that I clearly knew how and the ways in which I wanted to be supported. Because if I didn't come to supervision with questions, how was I ever going to do professional development? If I'm just expecting them to provide me supervision, but I'm not doing the legwork on my end, then sometimes our needs don't get met. Another part of wellness for staff is being, I'll speak for myself, being plugged into a network to be able to talk about hard days. So I had come from a background in a community clinic setting. A lot of the people within my network in my career field were either people in my clinic, other peers, but not necessarily first responders. And so I didn't really have a strong unit network to be able to confide in for hard days when I first started. And I think that is so crucial, having civilians and peers on teams, is that they have a network that they are plugged into to be able to talk about hard days.
Thank you, Lieutenant and Jessica. So I do see a couple of questions have come in on the chat. Excuse me, the first is from Rachel Jurin. Rachel says, our agency is looking at tracking the number of critical incidents an employee is involved in, and then requiring a wellness visit after every set number of incidents. This would be on top of visits made based on obvious need. This is particularly to reduce the stigma around the process. If anyone has to go, it becomes expected and normalized. What are your thoughts on this approach? And to kind of tack that on, I'm looking at you, Austin, around other data that you are collecting and impacts you're seeing from the wellness.
Yeah.
So I'd
Go
love
ahead,
to jump in, and you want to take it, Austin? Go for it.
You can go ahead.
Okay, well, I was going to say, absolutely. We took a similar approach with our peer support team at FirstNet. So following any critical incident, our approach was to be proactive versus waiting for them to call the peers in our team. So every disaster response, every individual gets a call from the team, because that's business as usual for us. And we wanted to establish, just like you were describing, that this is normal After we respond to disaster, we do our wellness checks. That's just what we do. And when we built it into our policy, which goes into some of our questions later, and how you build robust wellness programs, how do you make it a part of how you do business is the way to be successful. So from my experience, as well as what the literature would say, is absolutely the more you can normalize how you integrate wellness into your operations, the more likely they will see this as business as usual. Nobody is left out. Everybody has to do it. Just like you got to renew your BCLS or ACLS, wellness checks are how we take care of ourselves in public safety. So I would definitely support it from my perch. Austin, what are your thoughts on it?
Yeah, I'll just echo what Dr. Corey said. You know, one of the biggest things that you can do is I would potentially caution with having some sort of magical number of incidents, just because if you read a run report on the fire side, that doesn't really give you the full picture of what's going on, and it really doesn't take into account the personal lives of the firefighters themselves. What I would recommend is, in Huntington, West Virginia, we have critical incident policies within our police and fire department where things are automatically considered a critical incident, just by the nature of the call. So use of deadly force, victimization of a child, a fire fatality, or we have in that policy that any person on that scene can declare it a critical incident. And what happens? We have a soft approach that we take. We have really three phases that we can do. We have our embedded wellness coach that focuses on mental health. She's embedded in the department already. She is focusing on doing ride-alongs, and when things are normal, Amy's around, right? So whenever there's a critical incident, it is no big deal that Amy's around as well. So the most extreme of these cases is, all our staff has ballistic vest and we have turnout gear. And if the scene is safe and if it's a big call, our staff will be on the call there to take care of the first responders themselves. The second approach we take, which we try to caution, is a group check-in of some sort. Group check-ins can be beneficial, but it can also lead to everyone kind of commiserating and turning. But also, you have, particularly within law enforcement, typically when they see someone from a mental health background is when something bad has gone on, and they're fighting for their livelihood, they're fighting for their job, and they're trying to prevent someone from taking their gun away from them. We have to change that stigma. And a lot of times they shut down in that group setting. And I hate to say it too, it's also a little bit of masculinity. We're very much still a male dominated profession. And so if we get them, and this is leading into our preferred method, one-on-one check-ins, and it doesn't have to be formal where they go into the office of our mental health coach. Literally, what we'll do with our critical incident policy is Amy does ride-alongs on a regular basis. If there's a police officer that had a tough call where they've declared that a critical incident, next time we do ride-alongs, we'll slip in Amy where she's paired with that officer and they go do something to where, from the rest of the department standpoint, it looks like they're doing their ride-along shift. But really, she's having a check-in with that particular officer. I will say this, and we attended a national FOP conference not too long ago. The required annual check-ins for mental health, if they're not already a thing at your department, they're going to be a thing within the next 5 years or so. It is going to have to be the way that we as law enforcement, we as first responder agencies carry ourselves. With that, I would say if you do have embedded coaches, try to normalize relations, and basically try to count engagements. But to some extent, there has to be a little bit of anonymity to that as well. We have a lot of our data is protected. So the benefit of our program is that the Compass program is a completely separate department from the police or fire departments. We did that strategically because no chief has direct oversight over the department itself. And we're allowed to work in the departments, but at the end of the day, the chief is not our boss. And so we keep data for our sake. And whenever we do check-ins, it's simply, okay, Sam Holbrook attended this check-in. Anything outside of that is not reported to the department themselves. The only time that we would report is, if they are showing signs of suicidal ideation, self-harm to themselves, or, harm to another person. But everything is kept confidential, and it's worked in our favor for that. We only report attendance.
Perfect. Thank you all for those thought-provoking questions and responses. We do have some questions here in the chat, so I will invite Rome to come off mute and go ahead and ask your question.
Yeah, so my question was just like in general, I guess to Lieutenant Belli, how did you manage to generate interest for these resources to be utilized and kind of like destigmatize the perception of utilizing these resources?
I'm sorry, it was kind of hard to hear. So you're saying how we introduce the resources?
Yeah, it's essentially just how did you manage to generate interest for these resources to be utilized, just considering the stigmatism that comes along with, the perception of using these resources to your advantage?
Yeah, we're still doing that. I mean, again, I think what we figured out was starting with it's definitely generational. I started at the department, 25, 26 years ago, and there was no such thing. And you did not, the only reason why you ever saw psychologist or anything outside of that was because you did something wrong. They thought you did something wrong. They're worried you're going to do something wrong, or when you first came into the department, that was it. So we figured out real quick that we had to immerse ourselves, start at the beginning with the cadets. And then as we were working our way through the program was we had to go sell it. We had to start with supervisors, on down, because, just like everybody said, if it's not a regular thing, then yeah, right away it's suspect, and we still deal with that. Officers want to, if they've been involved with, let's say, an officer involved shooting, it's automatic. That's one of the things that you have to do is you have to be cleared, by the agency's psychologist in order to return to work. And so it's just for them, that's just like another little check in the investigation. So we kind of had to separate the two things. And tell them, no, this is not a part of, administration on whether or not you're returning to work or not. This is merely for you, this is, and really sell the fact that, about the confidentiality, which is big, and that, and that's something you really have to get within your administration and stuff. Everybody has to buy in, because the first time it doesn't work out like that, you're starting all over with your program. So, we started with the cadets, offering them this, that, and the younger folks. I think because it doesn't have as much of a stigma as it did to maybe our generation of officers. Even in my generation officers, we fight that all the time, right? The way we figured is using peers really helped, was getting some of the older officers, the officers that have been around for a minute, supervisors that have been around for a minute, and actually getting them to be a part of the peer support program, or part of, pushing that narrative, because they're more likely to listen, to, and not think it's as, weak per se, to ask for help as it would be coming from the department psychologist, or coming from just the sheriff or the boss. They don't really listen much to that. But once we brought on peers, some of us have been around for a day or two, that seemed to help, because that seemed to kind of relax everybody to, like, okay, well, if this guy's willing to do it, then, I'm probably willing to do it. I'm willing to reach out to the person who's been here 25 or 30 years versus, somebody from the outside that's coming in to offer help. But it's constant. We're still doing it. I still will go to things where somebody will call me and say, well, I want to talk to somebody, but I don't want anybody to know. I don't want the supervisors to know. I'm afraid that, they're going to call administration so we have to constantly push that out. And again, I think it goes back to who you pick to be involved in these teams are really important, and making sure that you have buy-in everywhere. But yeah, we're still doing that. I would be lying to you to say that it's perfect now. They're willing to pick up the phone and call us, or they have no problems coming in, and they're not. It has gotten 100% better than when, like, I started, because when they first asked me actually to look into doing the peer support program, I was even like, okay, this is not gonna work, because I came from that same generation where you just didn't ask for help and you didn't get any time off. It was like, are you good to go? Yeah, I'm good to go. Okay, you're back to work the next day because you weren't about to say that you weren't, you know, because bad things did happen. You know, the moment you said, well, you know what, I think I need a day, I need a day to kind of like process how I'm feeling. You were out for a week waiting to get for a fit for duty, you know, to see if you're even going to come back to work. And so that's, you know, we did that to ourselves 20 years ago. So we kept people from reaching out for help. And now we've had to completely redesign that system. And then now we're really having to like rebrand it, so to speak. So we're still constantly doing that, you know, but I would highly suggest that you get people involved that have been at your department a long time and that are respected in your department and get buy-in from them and get them to help promote the program or promote whatever it is that you're doing. And it makes things a lot easier, as well as the people that you bring in to help, making sure that they have first responder type of experience. That's one thing we found too. We had resources that through our county insurance or what have you, but that's the same resources that, that's for everybody. Right. And so there was certain folks that we had brought on that had zero first responder experience, and it's completely different. The things that we were dealing with was, not something they had dealt with before. So we had to really make sure moving forward, like, hey, the people that we pick, they're experts in this, whether they're psychologists or are, mental health clinicians, things of that nature. We're used to working with first responders, military, that kind of thing, because our problems were a little different. The mindset's a little different. And that was one of the other things that we kind of had to tackle, was making sure that we had the right people to reach out. Because once you suggest, you refer somebody who trusts you, I'm going to refer you to this person, and they aren't able to connect at all because they don't have any of that previous experience, that hurts you too. So that would be my suggestion with that as well.
Perfect. Thank you.
Do any of the other experts want to jump in before we move on to James? All right, James, you have a great question in the chat. Would you like me to ask it, or are you willing to ask?
I am more than willing to ask that. I appreciate it though. Lieutenant Fervaletti, did I get that correct?
You did. That was perfect.
Okay, listen, I take pride in that. When I'm dealing with my students, I take pride in pronouncing the names correctly. So the question I have for you is, you were mentioning something about your cadets and actually trying to get certain things accomplished up front. So I was just wondering what your department is providing for that holistic wellness in regards to cadets prior to them actually graduating and from the basic program. And the reason I asked the question is because you're absolutely correct when you talk about suicide, substance abuse, domestic violence, and things of that sort that we normally find within the first responder profession or industry to a certain extent. There are certain things that we probably need to try and deal with and handle prior to that point, prior to them becoming substance abusers, prior to them actually engaging in domestic violence and that type of thing. So I was wondering if there was anything in particular that you're actually doing at your department.
So what we started doing, and it's kind of a new thing, I won't even lie to you, because we're looking at, like you said, I mean, you want to catch it ahead of time, right? Before it becomes a problem, or so they can self-identify and say, okay, I'm starting to have an issue before it's kind of too late. So what we started to do was we would go in during our cadet classes and take, an hour or so on wellness and say, hey, listen, these are the programs we have for you, anywhere from peer support to, we have a chaplaincy program as well, depending on if it was, if somebody was more religiously inclined, get the chaplains in there to speak and talk to people. And then really was like laying out the benefits, like, listen, if you're having issues, identifiers, if you're going home and now you're feeling, you're having nightmares, talking to them about what PTSD is, talking to them about, aiding with alcohol or substance abuse, issues, trying to educate them so they can kind of self-identify as they're moving along, and telling them, hey, what we want to do is temperature check along the way. We want to be able to reach out to you in a year and see how you're doing. Because, a year into, and you probably know, a year into it, you're a completely different person than when you're sitting in that chair. So it is trying to temperature check along the way and prepare them for the things that they're going to experience. That was something I know. I don't know about you, but I never had in a cadet class. I mean, like I said, we learned to shoot, we learned to drive, we learned to write reports, we didn't have not 5 minutes on wellness. I mean, that wasn't even a talk that we ever received. So, so we wanted to make sure that we had offered, these are all the services that are available to you. This is, the folks that are involved in peer support. These are things that we want you to look for, as you're moving along in your career, if you're starting to see these certain things, or there's certain triggers, or there's certain, just like if you were going to get a cold, if you're medically sick, if you're having a chest pain, it'll be the same thing mental health wise, right? If you're starting to have nightmares, if you're not able to deal with things, you're quick to anger. We go through like the whole little gamut of things and say, hey, this is at the point where, we'd like you to reach out, to one of us so we can, or these are the resources that are available to you. Because again, we're trying to prevent you from having a problem in the future. But yeah, you're right. And we're still even revamping that, seeing what other things that we might be able to do at the beginning of their career. We get, like I said, because talking to them at the beginning is great because they have all the resources, but it's hard to explain to them until they're like a year out. And that's why we try to go the in-services. So then we come back after they've been there a year and we're going to hit the in-service, and then we re-engage, re-talk, re-provide resources. And you're going to see the difference because we've had, guys and girls that were cadets. And then when we see them get an in-service, they're already a year in or year and a half in. And they'll come up and tell us, oh yeah, like, I listened to what you told me, but I didn't get it until now, because now they've had a year on the job. They've seen a lot of things, been involved in a lot of things. And you could tell like now the wheels are turning, like, okay, that's why you told me that a year ago, So again, like we try to catch them there, literally handing out resources to them. We made cards. We're working on an app right now for our peer support program. We're literally, all you have to do is, every cadet will get it. They'll download it as a part of, anything else on their phones, and say it's an app that you literally push a button. If I want to speak to, it has everybody's profile on it as far as who's involved in peer support. Here are all your other resources. And, only certain admins have control over that, to include myself, so we try to keep it as confidential as possible on that. So and again, we're evolving as we're moving on. We just went to the COPS conference, which was the Concerned, Police Survivors Conference. That was awesome. And we got a lot of good things from that. But yeah, so really at the beginning of it, it's just really trying to go through and have them self-check as we move along and provide the actual physical resources that are available to them. And then coming back, in that first in-service or so, a year and a half later, to kind of check where everybody's at and to provide it again. And, just to kind of keep drilling it in their head, in case there's any issues with them moving forward.
Fantastic. Thank you. I appreciate your answer. And what I'll do is, because eventually I'm going to have to step out, I will actually put contact information in the chat for you. I'd love to be able to speak offline in regards to it. There's some different things that we're doing in the state of North Carolina in reference to trying to capture some of these cadets prior to, because once they graduate from the program, they go to the FTO. You don't always know what the FTO is telling them, right? So all of a sudden, that's a little bit different as well. So we're trying to deal with them within the program. We're trying to share information with the FTOs, same thing with the SROs. We're really trying to take a comprehensive approach in reference to how we're dealing with them. But still, it doesn't start at basic law enforcement training. It actually starts when they're like in elementary school, right? So there's a lot of different things that we're trying to do as far as that is concerned. So I will put that in here, and if any of you ever need anything, do not hesitate. Please, please just let me know. I don't deem myself to be an expert, even though I've been at this for over 30 years. I just deem myself to be someone who's concerned about the profession and the industry as it relates to first responders. So I will do that, and now I will shut up.
Great, thank you.
Oh, that's great, James. Thank you so much. It's helpful. The point of this being so casual and as face-to-face as we can get is so that connections are made even after this session. I am looking at the time and trying to be respectful of everyone's day. I would be curious, though, to hear from all the other experts as well, from your point of view, following off of James's question, what do you think the key aspects of wellness are for people in training, beginning this career? and then onward? What supports are needed? Especially, Jessica, I'd like to turn it to you as a mental health provider and peer. What does a responder like you need in training from these programs and then to support you onward?
Thank you for the question, Mari. One of the biggest things that I noticed when I started working as a first responder was that my roles as a peer prior to that really was to be this unique role, right? That was a different perspective, that was not your traditional clinician. But I wasn't really given the skill set to work on a team. So those were skills that I had to learn kind of on the fly. Being a part of a team, working as a team, a lot of times in corporate world that it's you're doing your best to meet your standards and so on and so forth. So that was a really big thing that I needed personally. The other was knowing safety protocols. So radio protocols, what everything was for being a person on that scene, because feeling safe and being safe are a part of wellness too for me. So really knowing those things so I felt connected if I was the person that was able to get to the radio or the car. And then also I've learned about like insensitivity to situations. And this happens just in the first responder world in general, where say a team was on a critical incident call and someone makes a joke about it, or, just in a very non-offensive way or intending to not be offensive, but because these people were directly impacted by this critical incident, it can come off as very insensitive to the situation. And so with that, as a peer, I think it's important for my team to know and learn what my soft spots are, as well as those on the team, because we all have certain soft spots, whether it's the elder population, whether it's working with kids. But knowing these things about your team can help you really stay safe, but also prioritize wellness for everyone involved.
Austin or Dr. Kerr, did you have any thoughts on the question posed?
So that is a great question, and I think the panelists handled it incredibly well. What we know from the veteran military population is the sense of community is incredibly important to our new recruits, right? And that's similar in first responders is what we do to facilitate those relationships and connections, especially as people are entering into the public safety organization, is what is the norm? And our norm is having each other's back, right? We are our brothers and sisters keepers. And I think that the more we facilitate how we build those relationships amongst the new recruits, and that peer support is the norm, it's probably one of the single most important things you can do in wellness. We recently, at the First Net Health and Wellness Coalition First Responder Summit, we had leading executives across the public safety associations in attendance, and they were asked that same question: what is the single thing that you should do to advance wellness within your agencies? And they all agreed that peer support was the number one thing you could start with. It doesn't mean it has to be the end all be all of your wellness program, but it does need to be it is a good place to start because it builds relationships. You can easily normalize it from how you respond to disaster and support critical incidents and mental health. You can integrate discussion about other resources that support wellness peer to peer, that is a trusting relationship without even going to the next step with a behavioral health provider. And so it's that stepping stone into how we discuss wellness further and further. So I would highly engage in peer support too, not just at the cadet level in building as they come into the agency, but throughout the career life cycle, as I believe both Austin and the lieutenant mentioned, were important, the generational differences and having those leaders build that community, because that's what shifts the culture as they take ownership of it and have roles to play. That creates that culture of wellness that we're seeking. I'm going to drop in the chat a white paper that has recommendations for first responder health and wellness and what needs to happen at the local, state, and national level. That may be some good nighttime professional development reading for the audience, but definitely lots of action that can be taken.
I'll just jump in real quick and say, my favorite animal, oddly enough, is a beaver. And the reason why I like beavers so much is because they change the world that's around them, right? And if you look at the current space, us that are in this profession currently, we have to change the norm. Because so often, if you think back to those of you that wear the uniforms of your communities now, what did you do when you first joined the ranks, right? You kind of conformed to what is the status quo. That same mentality can work to our advantage in some sense, and here's why. In the city of Huntington, West Virginia, we have portrayed ourselves as the beavers and have changed the world around us to where every new police officer and firefighter that is hired with the city of Huntington immediately goes through a academy that also includes a robust physical and mental health portfolio. So 3 days a week, they are focusing on a job functional workout with an exercise physiologist that's focusing on the functional movements of their jobs. And 2 days a week, they are doing a mental health curriculum where they're covering everything from resiliency, breath work, mindfulness, talking about PTSD, depression, empathy, grace, financial literacy, all of the things that are important to our picture of wellness. And that typically is about 6 to 8 weeks. I will say if you come from a smaller state like I do, um, you have to go send them to sometimes an academy for certification for law enforcement that's outside of your control. And that's the case in West Virginia. We have to certify all of our officers through the West Virginia State Police Academy. But we're fortunate enough to where we as a city, we have our own additional training, and that's where we incorporate the 6 to 8 week training. If you make it part of the job from day one, they're going to conform to that. And then suddenly it's not just this new thing that's, for lack of a better phrase, hippy dippy and foo foo and all of the terms that they'll throw out at you. It just becomes part of the job, right? Just as you certify your firearm, just as you do your CPAT, you are taking care of your wellness. And so I say that, and this goes for the cadets, but just this wellness program in general, we're going to have to become the beavers, and we're going to have to change the world that's around us.
So much, Austin. We are at time today. We definitely appreciate everyone's attendance, participation. I've dropped a link to a survey in the chat. If you would kindly fill that out, it will help us plan and inform future sessions that we have coming up in 2024. Resources that we have in the chat that will all be shared out via email along with the recording of today's session. Again, we thank our panelists for all of your wealth and your knowledge, and we hope everyone has a wonderful holiday season. Take care, everyone.
Thank you all.
Okay, bye-bye.
Thank you.
Thank you.